I often get asked about circumcision, and circumcision is something that you can choose to have done to your child if you would like to. I usually equate it with making a decision to have your child's ears pierced, as many couples will decide to do this quite early in their child's life as well. Circumcision is not considered medically necessary. We've had lots of studies that have reinforced that really it's not medically necessary. I would say that in my practice, roughly about 30 to 40% of my families do choose to circumcise their sons. And this is usually because of parental choice, often so that the father and the son will look alike. I think it's important for you to know, how often it's done, because your child might want to look like his classmates or like his peers down the road. So, these are often the questions I get asked. There are several places where you can have a circumcision performed here in Chilliwack. Because it's not medically necessary, it's not covered by MSP, and so prices can vary based on the provider.
So problems that can occur? Well, your baby could have some bleeding. There could be a blockage at the end of the penis. Your baby could develop an infection, or there could be irritation for the baby at the exposed site. So how do you care for this? When you come home, how do you care for this? Well, your baby's going to come home with a gauze on it with Vaseline on it attached to the end of the penis. This should stay on there for at least 24 hours. Always wash your hands before and after touching the circumcised area. You don't want to introduce bacteria to that area because it's an open area. Gently wash the area with plain warm water. Do not use soap, alcohol, hydrogen peroxide. These will not speed healing and actually will be quite painful for your baby. There will be a film on the end of the penis. Do not try to remove that on your own. That will come off on its own. Put plenty of Vaseline on your baby's penis, on the diaper, to prevent it from sticking. So when you take the diaper off, once that initial gauze is off, you don't want it sticking to the site, because you could pull off some of the scab. Also, fasten the diaper loosely to prevent extra pressure while it's healing. So if your baby develops an infection, so if they have a fever, if there's increasing redness and smelly discharge from the site, if they're just irritable and having a high-pitched cry, you should call either 811 or take your baby to see the doctor. Also, if you notice bleeding, a spot on the diaper greater than 5 centimeters, that's also an indication that you should take your baby to the doctor. If you notice that your baby hasn't had a wet diaper in 12 hours, there could be a blockage. So that's also another reason to seek medical attention.
If you're interested in having this procedure performed, there are a few physicians in Chilliwack that are able to do this, and they all use obviously sterile technique, and they all administer pain medication to your child prior to the procedure. And so if you're interested in this, please talk to your primary care provider and they can place a referral for you to have this procedure done.